Hi, I was wondering if you could explain what is harm reduction, Victoria.
Okay, well, I'll give it a go. For me, bottom line, it's just making sure that essential health services are available for all the members of the community, including people who choose to use illicit drugs. And it's just an absolute essential basic human right. So we're advocating in as many ways as we can to ensure that we have the harm reduction, all of the aspects of harm reduction, psychological, the health, the needles, whatever health needs a person has, they have a right to have. And they need to have, I'd like people to have an opportunity to have a space where they can access whatever drug needs they have, as well as the counseling services that are available. We're a group of concerned citizens, grassroots. I mean, we started to meet because they were closing the Cormorant Street, and we knew before they were closing Cormorant Street that it was underfunded, it was crowded, it wasn't meeting the needs of the community, and they closed it after having found at least a space where they pay an us and them situation. But I mean, BIHA and the city council and the police, they knew that we needed to have a comprehensive plan where all services are available for people. And it was a moratorium for 6 months, we heard. Well, it's been a year. It's been a year. So I'm sitting here handing out materials that I hadn't seen before, because it's needed. There are people in the community that need to have a safe way to handle whatever addictions they have without spreading them. I want the kids to be safe. I'm an old teacher, and I want children to be safe in the community, and I think that everybody needs to be safe. And so if one needle could save us millions or thousands of dollars in any case, because it will stop the spread of hepatitis C, AIDS, hepatitis C, the various forms of hepatitis are on such an increase, and it can be prevented. Once you have somebody, a place where they can stay and be supervised and with services available, then you start the rehabilitation. Everybody wants to see an addict cured, but you've got to start where people are. It doesn't matter what their age or what their issues are. You've got to start where they are. And if they are on the street and sharing needles, it's up to us. We've got a responsibility as human beings to give them the services and the materials that they need. And then to get on, there is a clear mandate. BIHA, there is, in the last 7 years, there's 10 surveys, studies, task forces. They're all talking about harm reduction. And the only thing that seems to be getting lots of money in terms of the 4 pillars is law enforcement. Well, enforcement is only one part of it. Harm reduction, 6-site needle exchanges, safe consumption sites, proper housing and access to basic needs. I mean, obviously I can go on and on, but who we are is a group of very unusual people, because there's grandmothers and there's kids in their teens probably. I don't know. They all look young to me, but we're people who are committed to a cause, and that cause is to promote health. It's a public health issue. It's not an enforcement issue.
And so today you are giving out clean needles to people who need them, and that's because there is no longer a needle exchange program in Victoria. Could you explain the issues surrounding the closure of the Cormorant permanent clean needle exchange?
Well, my understanding, and I've been educating myself at a fast pace. The services, obviously, if there's, I heard it explained so well by a doctor from Vancouver, if there was one coffee shop in Victoria, there'd be a heck of a lot of people around that one coffee shop. There was one very, very small fixed needle exchange, smaller than my living room, dining room, and family room. to be quite honest, that was supposed to service all of the people who were addicted and needed to exchange needles or have a safe place to have a cup of coffee, to get in out of the rain or the cold or whatever it was. And those services were very, very minimal, and the funding had been cut. Therefore, people were hanging out there because they didn't have any place to go. They didn't have a place to go to the bathroom. They didn't have a lot of the services. It was an eyesore. It was a problem. So they decided that they had to be evicted and closed. Rather than finding another temporary site, they bought the property of they decided to have St. John's Ambulance open as a needle exchange, fixed needle exchange, which is exactly in the harm reduction model, where you have a variety of services available so that somebody, at the time when they decide, I don't like this anymore, I want to do something about it, you can't tell them to come back next Thursday at 2 o'clock. You've got to have somebody there that will immediately talk to them, that can help them through whatever the stages are of their rehabilitation or whatever. So anyway, I'm going on and on. But they closed the site, and because there wasn't proper community consultation, and said that they would have a mobile. Well, if you look at the clientele, you're supposed to match services to the abilities of a clientele, and I am very sure that a mobile bike program and bans are good for some people, but there's privacy issues, there's the actual reality of being able to find your way from one place to another place. We're talking about people with addiction issues, and they're supposed to be able to access mobile services. It just is inadequate. All the research says it's inadequate. All the research says that you need fixed sites, not just one, but many sites, so that people are spread out so that they can get services in their community.
And the mobile service is actually prevented from distributing needles in certain locations. Could you tell us something about that?
Yes. This is the area where the majority, we all know, the majority of people on the street find services available at our place. That doesn't mean all the drug addicts go to our place, but this is the area, the only area that's left. And this is the area where a code of conduct, a no-service zone, was agreed to by VHA, who has the mandate to provide the essential health services, the community association and the police, that the mobile are not allowed to come into this zone. And this is where the majority of the clients are. And so, there's a no-go zone around here where all the supports are. So it's
not allowed by the police or by the health authority?
The health authority has agreed that people, the SOS, the street outreach services, and the vans, and so on, in other words, the mobile units, are not allowed to come into this area. They can walk in, invite people to go to get the services. They're not allowed to distribute. Any health clinic can distribute these things, but they're not allowed to because they want this. I don't know where the people are supposed to go, but they don't want them to be here. And I cannot speak for them, but in my opinion, it's not a just solution. It's not a fair choice. These people deserve basic health care, and their needs have to be met where they are.
So instead of dealing with the problem and acting responsibility and taking initiative to help prevent the spread of diseases, the local health authorities have taken a very NIMBY, not in my backyard kind of approach to this situation?
Absolutely. The neighborhood. Nobody wants a fire hall necessarily in their next door neighbor. We all know what NIMBYism is, and they don't want the services here. Too bad. They have to be somewhere. It's time they found some.